Good evening, everyone, and welcome to the presenter series in preparation for the IACT IMDHA Hypno Expo coming soon to Orlando, Florida. As a matter of fact, on March 17th, 18th, and 19th is the weekend of the conference. And in this series, we interview people that are presenting pre and post-conference programs. So the days immediately before and after the weekend are when those programs are. Uh, that's what we're here for. And actually, Karen, I wonder, would you be so kind as to open up the doorway and introduce our first presenter?
I absolutely would. And uh, this is going to be a great talk. If you were with us last week, you saw a little bit, a little hint of what Bruce is going to be teaching. Dr. Bruce Eimer is bookending the conference because he has a presentation before the conference and a presentation after the conference. So we get to talk to Bruce tonight about hypnosis and surgery, post or pre-surgery, and maybe post as well. I'm going to let Bruce detail what he's going to be teaching, but let me tell you about him first. Bruce is a board-certified licensed clinical psychologist who's been using hypnosis, clinical hypnosis, to help patients control pain since 1986. He has a full-time hypnotherapy and psychotherapy practice in South Florida. He's authored over 8 books on pain, psychotherapy, and hypnosis. Dr. Eimer regularly teaches workshops on pain control, hypnosis to pain control hypnosis to hypnotherapists, psychologists, psychotherapists, physicians, dentists, and nurses, and tonight to us. How about it? And Bruce is going to be there tonight. Bruce, we're talking about, this is the post-conference training, is it not? Or am I backwards on that?
No, this is the pre.
Okay, wait a minute. We're doing the pre-conference, which is surgery. The post-conference is taming pain, and the pre-conference is
Preparation
hypnosis
for
for
surgery.
surgery, preparation for surgery. Please. Now, is this like weeks before surgery, a day before surgery, or just prior to surgery, or is it encompass all of that?
It's weeks before surgery, ideally, because what I'm going to be teaching is a protocol or a job that I've done for a very, very long time that I learned from the masters, my mentor, Dr. Dabney Ewan, who was a surgeon and an emergency room physician, developed this protocol, and he taught it to me. And we wrote about it in several chapters, several articles in a book that we co-authored. And ideally, you want to work with a patient several weeks, even several months before surgery to prepare them psychologically and behaviorally to be most prepared for their surgical procedure.
We as patients who are about to go into surgery, man, I get it. Before I had my hips done, I definitely saw a hypnotherapist to get the mindset right. I get it. We get it. But how are we getting this information, Bruce, out to the general public? Are there doctors now telling them to avail themselves of this advantage, or how are people finding out about it?
Unfortunately, people don't really know. Unfortunately, people don't really find out that this can significantly help them in many ways in terms of reducing their anxiety and promoting positive outcomes before, during, and after surgery. They don't know this unless they actually interface with somebody that does this, or somebody that knows somebody well and works with somebody that does this. So all my patients that are going to have surgery, if they're seeing me for other things, they get it. They get, I prepare them psychologically with hypnosis. I get some referrals, but by and large, in the majority of cases, physicians and surgeons just do what they do and don't even think about it.
Let's say for a moment that someone didn't know, they didn't hear about it. But they get to the hospital, they're a couple of hours before the surgery, they're getting prepped. Can something be done at that point?
Well, I mean, I can only count a few fingers on one hand when I worked in a hospital setting, which was for many years on and off, where I was called in to deal with a patient that was having a panic attack before they were prepped and sedated. So I mean, it can be done, but essentially it's not done often. And usually what happens is, they'll call a psychiatrist in or somebody like that, and they don't know what they're typically what to do.
Good luck with that.
Yeah, yeah. But the only close similarity to what you're saying is my mentor, Dr. Dabney Ewan, was a pioneer in the hypnotic treatment of burns in the emergency room. So, when patients were wheeled in acutely right after they suffered a severe burn, he would, because he worked in the hospital, he would often be called and he would interface with the patient and basically say to the person who was already in a trance due to their fear and anxiety, he would say, would you like, he would introduce himself as, this is my name is Dr. Ewan, and I can help you to feel more comfortable. Would you like me to help you feel more comfortable? Invariably, the patients would say yes. And he would say, well, then just listen to what I tell you to do. And then he would just proceed to do hypnosis and give them suggestions. But that was in an emergency room situation.
So without me throwing out more questions, give us an idea of what you're going to be teaching in that class.
Well, sure. It's a one-day workshop. And what I'm going to be doing is I'm going to be, first of all, talking. God bless you. I'm going to be talking about how positive surgical outcomes are promoted by good psychological preparation for surgery. I'm going to talk about the components of psychologically preparing somebody for a surgical procedure. I'm going to be talking about how hypnosis can magnify the benefits of psychological preparation for surgery. And I'm going to teach my protocol for doing it. And of course, we will have some demonstrations and perhaps some practice.
I'm sorry, Michael.
Oh, it's okay. I just can't help but think that for people who take this class that this is an important piece for a hypnotist or a hypnotherapist to add to their to their toolbox, and that along with it, and I know this isn't one of the questions you gave us, Bruce, so I hope I'm not throwing you a curve here. But along with it, it seems to me that that when somebody's having major surgery, that this is something that can be a disruption, in an entire household and family. And all of the stuff that comes up isn't just about the surgery. So the thing that's curious to me is I can see how it would make open up a whole lot of different areas in a hypnotherapist's work. And I'm wondering, people have taken your classes and stuff. How have they incorporated it into their regular practice?
Oh, well, I think that people, from the feedback that I've gotten, I think that people who have taken this course with me, they keep their notes, they read generally, if they're interested in doing this, they generally obtain a copy of the book that I co-authored with Dabney Ewan, which is entitled Idiomotor Signaling for Rapid Hypnoanalysis. They read the chapters on this, and then they just start doing it.
And by the way, I might mention to our audience that Bruce wrote the book with Roy Hunter. It's kind of interesting because all three of these different evenings we've been able to talk about this book, and and it's really a good one. Again, I was going to hold it up the last time, but I think you had it handy there, Bruce. So for people who aren't familiar yet with that, there's a lot of good material that comes from this guy. So, well, back to you, Bruce. I don't know what else to say. I'm gushing, I think, at this point.
Thank you. Yeah, somebody asked me to put the name of the book in the chat, so I'm just writing it here. Ideomotor Signaling for Rapid Hypno Analysis by Ewan and Eimer. I think it's 2006. So let me just throw that out here. I don't know. Are you talking about the book that Roy Hunter and I wrote, The Art of Hypnotic Regression Therapy?
Yeah, and didn't you also do some stuff? What I remember is that Roy let us know that it was through his association with you, in fact, that he got some of his work accepted through the psychological
Oh,
channels and stuff. And yeah, so maybe I'm going in the wrong direction. I don't want to take your time up with something that isn't useful. But it other than to testify to the work that you've done has been great and has been really useful to our community.
thank you. Thank you. Yeah. So, I mean, basically in this one-day workshop, we're gonna cover what are the main issues that a person that's facing a major. Let me first back up and let me just say that what I'm going to cover is going to be relevant to preparing somebody for a minor surgical procedure, a day procedure, for going through a medical test, let's say, that they have a lot of anxiety about, let's say an MRI, a closed MRI. I've done a lot of work with people that are afraid of needles, that, have to get blood drawn or have to get injections.
Right.
But when it comes to like major surgery, we're going to be talking about what issues do people face. So for those of you that are listening right now, if you think about it, think about if you've ever had a major surgical procedure. I've had a bunch where I was put under general anesthesia. And think about what your main fears are. Just take a moment to think about your main fears. And, they basically fall into three categories. There's the fear of going under, the fear of anesthesia.
Yeah.
There's the fear of pain. And then there's the fear of negative outcomes. Okay. So we're going to be talking about what these fears are. The main fear of anesthesia is not waking up and dying, right? The main fear of pain is that you're not going to have enough anesthesia, to prevent pain from breaking through when you're under anesthesia. And fear of negative outcomes is a bunch of them, but the main ones, again, are fear of dying and fear of being crippled, fear of having a botched surgery. So, preparation for surgery has to address these fears, and it has to address them in a rational and a realistic manner. Okay, so we're going to cover all of that. And then we're going to be talking about essentially how a person that is, preparing for a surgical procedure. And please understand that when somebody is getting ready or waiting to have a surgery, they're preparing. They either prepare well, or they prepare poorly, and not addressing one's fears is not a good way of preparing. So what I do and what I'm going to teach as a hypnotherapist and as a psychologist that specializes in preparing patients for surgery using hypnosis is I'm going to be teaching how to adequately assess the pre-surgical patient and to come up with an individualized program to prepare that person for their surgery. You got to address their fears. You got to give them information, and you got to promote their confidence in the two most important physicians in the world that they're going to interface with. And those two most important physicians are their surgeon and their anesthesiologist. It's really also very important to recognize that we know that research is pretty conclusive about the fact that when we're under general anesthesia, the unconscious mind still hears and interprets sounds in the OR. Okay. And so we teach patients both through waking state suggestion and also the use of hypnosis what to pay attention to and what to ignore, both before and during the surgical procedure, before they are put under and while they're under, and when they're first waking up from anesthesia, when they're highly suggestible in the recovery room. I also work with patients to help them build their confidence in their surgeon and their anesthesiologist. So that's very, very important. And then I teach, of course, I'm going to teach in this workshop, the stepwise protocol, how to choose an induction that's appropriate to the patient, and then how to teach self-hypnosis for the patient to both prepare themselves for surgery and to use when they're going into the OR, when they're being prepped. So they can actually use their self-hypnosis procedure and go to their pleasant place, their happy place, their laughing place, and that, basically present the idea to the patient that, when you're going into surgery, you're turning yourself over to your doctors. It's like flying on an airplane when you're a passenger. You can't fly the plane and be a passenger. I mean, you have to just trust in the pilot. So when I work with people that are afraid of flying, I prepare them for the idea that they can have confidence in the pilot or the pilots, the captain and the first officer, and that they might as well just enjoy their flight.
This is a pretty important part of what you teach, I'm guessing, Bruce, because you're not going to the hospital with them.
True.
You have to give them all of these suggestions and techniques and ways that when they get there, they haven't talked themselves back into the fear or taken a suggestion from some family member, as you were talking about, what to listen for and what not to listen for all the way up to the surgery. That's brilliant stuff you're talking about. Some things that some of us just don't necessarily consider.
Well, that's why it's important to start working with somebody months before their surgical procedure. And it's also important to incorporate significant others in the process as well. So that I do that.
Right. I really appreciated the fact that you say that you're preparing them so that you're empowering them, so to speak, to go and have their surgery in the best possible frame of mind. And how important is that frame of mind? How much do you work with prospective patients on going into that surgery, believing they're going to come out of it rather than believing they're going to die in it?
Well, let me say something. This is such a very good question. There's clear research that shows that there's a much higher prevalence of fatalities if a person cannot project themselves into the future and see a successful outcome. In other words, and this is really important, we'll be talking about this in the workshop, but I'm glad you raise it, and that is that it's important for, of course, surgeons don't typically do this, but if I'm working with somebody, I will. I'm going to work with the patient to actually have them visualize the outcomes of the surgery. And if they visualize themselves being crippled or dying, then I get their permission to call the surgery off, to talk to the surgeon and suggest that it's a bad idea to go forward with the surgical procedure.
All of this stuff you're talking about is really important stuff for even hypnotists who aren't going to work with somebody in surgery. Who do you recommend actually takes this course?
I recommend that all hypnotherapists that essentially have any opportunities to do medical hypnosis, to work with medical patients, take this course. But even in addition, I mean, there are many hypnotherapists that don't, kind of specialize in medical hypnosis, that use hypnosis, in psychotherapy, that work with patients with trauma and things of that nature. And they're going to have patients that they're going to be seeing, or they're going to come to them, that are going to be having an impending surgery. And they could greatly benefit from the material that I cover.
You talked about an assessment that you'll be teaching people how to assess their people, their clients that they're working with, or the patients they're working with. Everybody is so different. I mean, people just react to life so differently. How do you teach somebody to pick out what the one thing is? What is your secret about that?
I don't know if it's a secret. It's a good question. I mean, the assessment is important. And as a psychologist, I, certainly assess the psychological stability of the person that's anticipating a surgical procedure. I was actually for many years doing screenings for bariatric surgery and also for implantation of spinal cord stimulators. And, we would recommend that those procedures not be done if somebody had severe emotional disturbance. So you need to assess for psychological stability, okay? You need to assess for prior psychiatric and psychological and medical history, you want to find out about if a patient has any history of trauma. That needs to be understood. And more specifically, do they have a history of medical or surgical trauma? You got to know that stuff.
Dr. Eimer, you can get away with all this stuff you're talking about. You just brought me around to the notion that, oh my gosh, can I, in Illinois, where our rules are kind of don't set yourself up as anything to do with the licensed professions, right? Can I, as a lay hypnotist, work in this arena?
Yes, it's another great question. You ask such good questions. It's like, here's how it goes. I think it's IMDHA, or is it NGH? I don't know, maybe both, that publish like ways of speaking as a quote unquote lay hypnotist or professional hypnotherapist, so that you're not, so you're not stepping into territory that you're not licensed to practice in. For example, if you're not a licensed mental health professional or a licensed psychologist, whatever, you can't treat depression, but you can use hypnosis to help somebody to be happier and less sad. Okay, right? So you can't do anything psychological if you're not a psychologist or a licensed clinical social worker, what have you. But what you can do is you can evaluate what a pre-surgical patient needs to understand in order to have a better surgical outcome and less anxiety. Okay, so you can do that. So if you use language in a way that doesn't throw you into territory that you're not licensed to practice in, you can certainly do it. Hey, listen, you're a professional hypnotherapist, which means you use the hypnosis tool to help people to achieve certain behavioral and emotional outcomes, okay? And preparing to have a smooth ride through surgery is certainly within that bailiwick.
Such much better language for me. I'm not correcting your language, Bruce. That's not what I'm meaning at all. But that was great language for me to use rather than as I treat you for this, right? As we go along on this journey. And so will you help the folks in your class learn ways that they can really successfully talk to their folks about this kind of thing?
Absolutely. I anticipate that there'll be some licensed physicians or nurses or mental health professionals taking the class. And
God, I hope you have an arena full of them.
I do.
Sorry.
And I do know, with those folks, like we can use the term treat, but I'll also be covering what types of terminology people that are not licensed health professionals can utilize. And again, we'll be talking about, so you don't want to use the word treat. You want to use the word assist. You want to use the word facilitate, promote desirable outcomes. There are so many. You're really big on great use of language, Karen. You've done some wonderful work on that, and I love your books. And so that you could substitute words that don't put you into hot water.
And that's a very important thing for us to know too, because we can do, as you said, all of the same stuff.
Mm-hmm.
And we can do it without a fear of litigious actions as long as we phrase it properly. And we can do all of this stuff with everyday, ordinary folks who are
very
facing
important.
situations.
It's very important because unfortunately, there's a significant percentage of surgeons that are terrible in their use of language. And they use language that causes trauma and gives people like you and me business.
So, we're almost out of time, just a moment or so, and I've been throwing out a lot of this stuff, Bruce. I'm sorry to have monopolized so much. Does anybody have questions? If you've got one, we'll certainly take your questions. Raise your hand or unmute yourself and ask quickly so we can get your question in. Yes, Ray, unmute if you will, please.
Okay, I am. Dr. Eimer, but thank you very much for talking. Question, do you give these classes via Zoom or is this strictly in person?
Well, what we're talking about tonight, is an in-person course that I'm teaching on Friday, May, whatever it is, May 16th. Thursday, the 16th, is it? Or Friday, the 16th?
Thursday the 16th. Thursday the 16th.
Yeah, that's going to be at the HypnoExpo 2024 in Orlando, the annual meeting of the IMDHA and IACT. So it's going to be live. But I also teach hypnosis for surgical prep, and I teach hypnosis for pain control on Zoom as well through my own business, my own practice. And those are all, you can look at those on my website, bruceeimer.com.
So I'm quickly scanning if there's another question.
I don't think so.
I don't see one. So Michael, I'm sorry. I don't mean to
I
monopolize.
have a question.
Yeah, Patty
Here
has.
we go.
Real quick, I'm just curious, Bruce. I probably know the answer to this, but I'm just curious. If you're teaching people who are non-licensed hypnotists to do this work, do you recommend that they do get a referral if someone asks them to work with them a few weeks before surgery, let's say? Do you usually recommend that they would get a referral from their treating physician or no?
Absolutely. Absolutely. I recommend it. I strongly urge all hypnotists to get that referral, because not only does it protect you from liability, but in some states, obviously, it's required, but it also establishes a connection with the physicians. Right. Which is what you want. Ideally, if you can have some communication with the surgeon or the physician who does have a relationship with the surgeon, that's going to be better for the patient.
And by the way, that's a brilliant tease, because coming up, Patti Scott and Eric Rosen will be talking about medical hypnotherapy. So thank you, Patti, for putting that in. Bruce, I just want to say we're so almost out of time. And Steve, I see that you have a question. If you'll type it in the chat room, we can get Bruce to answer it that way, I think. What I do want to mention is what we're talking about here today. Preparation for surgery is pre-conference. That'll be the Thursday before the conference. After the conference, Bruce will be talking about taming the pain in a 2-day post-conference event. And he's got a bunch of other stuff at the conference too, I was just noticing. On Friday, hypnosis for cancer patients. And then on Saturday or Sunday, I'm not sure which day, but you're doing a fundamentals class, I think, something like that. Is that right, Bruce?
No, the fundamentals of
here it is, fundamentals of pain control. Yeah.
I'm doing that too. Oh,
so,
hey.
My friend, you're on the schedule. So what I'm going to say is, just like everybody else, Bruce, you check the schedule, everybody else check the schedule, and join us pre-conference. Save the date. You can see how important this stuff is.
And one more thing, if I might add, that on May 19th, Bruce is also doing a luncheon on surgery preparation as well. So we've got you for a lot of things, my friend.
I was going to say, keeping me busy.
I gotta tell you, you can get your information about surgical prep during the luncheon, but you can't eat anything for 24 hours before you have your surgery. So eat up and enjoy.
All right.
Bruce, thank you very much. We really appreciate you again tonight. Thank you.
Thank you. Thank you.
Looking forward to seeing you in Orlando.
Oh, definitely.
Oh, right. Well, ladies and gentlemen, you are in for a second treat, one after another. The hits just keep right on coming. And we're going to be talking in just a moment to Patricia Scott and Eric Rosen about their medical hypnotherapy program. And I'm going to introduce, I want to introduce Eric first. And just to tell you that Dr. Rosen, the official introduction here is that he is an adjunct faculty with the Florida School of Professional Psychology at National Louis University in Tampa. And he is a certified master trainer for IACT and IMDHA. And those are things that we certainly salute him for. Because I happen to live here in Florida, I get the opportunity to see him from time to time in various venues. And he's done some great presentations for us at the Hypnosis Education Association, our local group here, and been at the conference doing this work with Patti for a number of years. So if you don't already know Eric, I think you're in for a treat when you hear what he has to offer here. But then and again, respectfully, Eric, I love you. You're great. But I have to move on to Patti Scott for a moment because I don't know if you know it, but in the last century, Patti Scott and I invented hypnosis in Southern California on one particular weekend, and we've been doing it ever since. But of all the people that I know in the world of hypnosis, I've known Patti longer than anybody else, almost, but real close. So from the last century, anyway, not the middle, mind you, but it's been a great ride. It's been wonderful to be affiliated and associated with her through these years. And I did a bunch of training with her here in Florida when she first moved over this way. She's one of the greatest people that you will ever want to know and has been nurturing this medical hypnotherapy program for years and years and just keeps making it better and better. So welcome, Eric. Welcome, Patti. We are delighted to have you here with us this evening.
Thank you. One of the stranger introductions I've ever had. Thank you, Michael. I expect no less from you.
Many
Oh,
of you who hang out with us a lot
yeah,
will
yeah.
recognize that I've never introduced Patricia Scott. I've never had the opportunity. I don't get to say that I just think she is amazing because Michael always has the honor of introducing Patti Scott. You're going to find out why coming up. Yes, she deserves that halo or the heart, either way.
Boy,
And they're a great team.
I feel great. How about you, Eric?
Oh, absolutely. And I concur with all those beautiful accolades for you.
There you go.
It's like a fan club here.
Well, so let's
So
get right to this.
and let me just say that since I met Eric, which was pretty, Dr. Rosen, I met him actually because I was looking for some office space when I first moved to Florida. That's how we met. And that's one of the things that we talk about in this training, interestingly, is just what we were doing, and that is collaborating and cooperating and partnering, with different people in the medical field, because he is a licensed psychologist, of course, and I am a hypnotherapist who is not licensed. So that's kind of part of our history there.
Well, this is a wonderful thing that kind of is in the conversation this evening, because as Bruce was finishing up a few minutes ago, we were talking about maybe the relationship with the doctor, and those sort of things. And this idea at least occurs to me of if I'm a patient somewhere, I'd like to feel that the people that are working with me are a part of a team, and that I'm a part of a team with them. So when you talk about just this kind of work as well, the work that you do with other hypnotists and how we all sort of learn how to work within the medical community, that's just great stuff. So who can really benefit from taking this 1-day training? Who is that? Who is that for?
You want to take that one, Eric?
Sure. Well, one of the things that Patti and what I appreciate so much in working with Patti is that we've discovered that there is a beautiful blend between the certified hypnotherapists and licensed clinicians. In other words, historically, it's been kind of like two camps. And what we're finding is there's a bridge here, and that oftentimes certified hypnotherapists may be afraid of calling the issue that we're working with medical hypnosis. Like, we've had questions like, oh, do I have to know anatomy? Or do I have to understand all these diagnoses? And the truth is that hypnosis can be applied in so many beautiful ways. And the course actually helps build confidence for licensed people and certified hypnotherapists to see all these different domains of help. I think that we are guardians of hope. And what we bring to people is hope that they can have relief with their suffering. They can find ways to feel better. And anytime we're dealing with issues with body and health, it's such a core, intimate, personal experience.
Yeah.
So we just have tremendous faith in the conduit of hypnosis and how to help you all learn how to benefit to help others.
Yeah. Eric, when you said, do I have to know about anatomy in order to do this? I think that you might need to know your knee from your elbow, but the thing that I'm really clear about,
Or other body parts.
yeah. And I've got to thank you for this though, because I think you really made me aware a couple of years ago when I was talking to you about the quality of relationships that the medical community and the hypnosis community can have with each other, particularly given the fact, as I spend more and more time around medical people, I see doctors that have like 7.5 minutes to spend with their patient. And patients want more than 7.5 minutes, need more than 7.5 minutes worth of attention or ministry or whatever it is that you want to call that. And it's this lovely place that hypnotherapists can really kind of step in and fill that void.
Absolutely.
I didn't put a question mark at the end of that, so I noticed the silence. But again, it really is something that I think I really heard you talking on it, and it got my attention. So I appreciate the idea.
And that's really in this class that one of the things that we talk about. And Eric and I came up with a new acronym because a lot of people, they're just not confident. Like Eric said, they're just not that confident to work with, or something about it scares them to work with medical issues. But anybody who's doing basic good hypnosis or hypnotherapy, whichever they're calling it, with their clients, they're already affecting indirectly, of course, any medical issues that person has. Even if you're working with a smoker or something else that doesn't require a referral. And I think most people doing this work have discovered that pretty early in their career. So the thing that this training is meant to do is mostly get people that are already affecting those things in the peripheral to be confident, to know that they can directly address it. And we came up with the acronym for the approach for the beginning, part of this to be HOP, and it's Hypnotic Outcome Protocol. Because when they go to a doctor, and this isn't about a cookie cutter or creating some kind of a slot or a box to put someone in. As a matter of fact, it's the opposite almost of what doctors do. But we wanted to come up with something to make it a directive, a way, an approach, a starting point for hypnotists to feel confident that they know what direction to go. And that includes all of the things we were already training up until we came up with that acronym, I think just within the last year or so. And that's about the very specific and the initial interview for a medical referral for a medical type issue is different. And there are different things that we're wanting to focus on and pay attention to and hear what I call the subtext, the meaning behind the words, because we're dealing with things. The doctor, deals with the symptoms and the condition and the physical part of it. And we can, of course, also as hypnotists, as hypnotherapists, we can help people with symptom relief as well. And sometimes that is even necessary to begin the work if it's a pain issue, but then we can go beyond that. Once we get in there and get that rapport and we get that trust. And by the way, they trust us even more if they're being referred by their doctor, who they already trust, hopefully. So there's that credibility that we have, that we can get in there and we can spend more time, like Michael was saying, much more than 8 minutes, 2 or 3 hours, some of us spend. And we can really get to the meaning behind the words, which leads us to the actual deeper elements that are affecting, the cause, the real cause of what their problem is, instead of just treating that surface. So I think that makes us an indispensable partner in that partnership, in that team, in the medical team. And that's part of also what we talk about, is how to integrate and how to become an indispensable part of the team with doctors, how to speak the right language about it.
There is a way, is there not, to talk to a doctor so that they don't feel like they're talking to a lay person, so they feel like they're talking to a fellow professional.
Eric.
Yes, yes. One of the things that we talk about is that Bruce brought up beautifully, has to do with what we refer to as scope of practice. And whether you're licensed or a certified clinical hypnotherapist, it's knowing what are the guardrails? Where do I go with this so I don't move outside what I am capable of doing? And even
Or
as a
step on
licensed person,
anybody's toes, or give the
oh
impression of
goodness.
stepping on anybody's toes, right?
And we talk very strongly about some of the different scripts that will save you pitfalls, that basically can help you so that you're not creating liabilities. And it actually, that's the way you create partnership with licensed folks. It's not competing with them. In other words, if someone comes in and we can offer hypnosis to create more relief, to take suffering out of pain, we're not competing with conventional medicine. We're not saying we're going to take you off of your medications. We're going to help you find ways to have more comfort and relief. And these are some of the scripts that we'll get into.
Eric, is it also true that if one goes to, say, a urologist or has an encounter with a urologist, and they can tell them, I can help you with those IBS patients who are problematic, that the IBS patients who inevitably are problematic will be referred over because you've just helped them out. And doctors refer. That's what they do. They refer to another specialist here, another specialist there. Why not have you in their bank of specialists? Right?
Absolutely. Well, one of the things that that Patti brought up that we help teach in the course is how do you do pre-talk that helps to bring out what the issues are that people have. We also teach a little bit about something that comes out of what's called health psychology, and what that it's not a real academic subject. It really has to get into what is the meaning of this illness for you, because we assume that the meaning of an illness for someone must be, oh, because it makes you feel uncomfortable. But what we find is that many times in listening, learning how to listen to people talk about what they're going through, it can involve core feelings about damage, about loss of safety, security, feeling lovable, being able to feel that you're still equipped and capable, worthwhile. I've worked with people going through medical issues where it's surprising, but they might be worried that they can't keep taking care of their partner. And that might be the essence of what is bothering them about a medical issue.
Yeah.
So we can, in finding what their core issue is they're having and listening for it, I weave that into the hypnotic language. I actually use their words, and we teach how to do this. That fits with what Patti was talking about with the hypnotic outcome protocol. It like individualizes what we're doing for people.
Well, not to mention the fact that you may have clients who come in and start talking about stuff that they didn't even call you and tell you they wanted to work on, but this comes up. And if you know what you're doing, if you have this training, then you can be more of an asset to them, right?
Yes.
It's just so clear. Sorry, it's just so clear to me that there are so many issues involved with medical procedures and medical conditions that people are dealing with. So many issues that are not medical issues. So again, it becomes this place where if you are just reliant on the usual medical community to help you, they don't know a whole lot about how to help you deal with the family situations that are arising around this condition or situation or anything. So it's really nice that we actually have a broader arena to operate in terms of what we can do, and so much to bring to this. I want to know something about certification, because I guess that there's that this training can lead to certification in medical hypnotherapy, and I want to know how that works.
Yes, this is a one-day training that's meant to be a standalone, by the way. And this one, anybody interested is welcome to be there. So they will get a certificate of completion for this training. It is sort of an introduction, though, to the 50-hour medical hypnotherapy specialty certification that is going to be starting online. We do that one because it's a 50-hour training, counting 4 weekends online. And then there's outside practicums, and there's some educational exam type write-ups that people do, and some other things. But that's going to start on, let's see, June 8th and 9th for every other weekend. And that's all online because we get a lot of people from other states and even other countries now that take this. And that is for certification through Up Hypnosis Institute, which is my company. And then also, if they're a IMDHA member, they get a certification, a separate certificate from IMDHA. And if they aren't a member, they can join and get that later at any time because they've already taken the course. So that's a certification that can be, again, it's about credibility, and it's about having something when you go to the doctor. Again, the more certificates and the more training, and the better that you can speak their language and show them how you can help them to look better. Doctors love it when you make them look good. If you remember that when you're talking to doctors, you'll go a long way toward being their friend. And here's how I can make your job easier and, let you do what you're good at. And I can help you so that your patient will be more cooperative or be more compliant to using the tools that you're giving them, or, easier to work with. So that's all part of it too, that we really get into being that true partner and staying within our scope, which is something very unique that doctors and nurses and other people, first of all, don't have the time to do with those patients, but most of them don't have the training or the skill to do. So we can work with them in that way too.
And we can also, oh,
I'm
I was
sorry,
going to say,
are there any prerequisites to taking the course? I know that you come away with a lot.
For the 1-day course, no, just if you're interested, basic hypnosis training is helpful. Obviously, we're not going to be teaching basic hypnosis in that class. The certification requires at least 200 hours of formal training someplace credible, and most people can just figure out where that is. Or if they're an IACT member already, of course, they're already have enough hours, IACT or IMDHA. So that's what's required for the certification training.
Eric, I apologize. I cut in
oh,
on
no
you.
problem. I was just going to throw in that what we also cover is how to build your practice. Because by understanding where you can apply these things, you could market to urologists. You could work with endocrinologists. For a real quick example, someone has diabetes, they might need motivation to have better eating habits. You're not telling them what to eat, but you can build up that motivation through hypnosis to eat healthier, to exercise. My goodness, that motivation can empower people, and then you can market that.
And the other thing is that, doctors and our medical system is very good with acute care. Okay. That's what our system is really good at. It's not so much with chronic. And one thing that hypnotherapists are great at is chronic conditions. That's where we can really have a vast array of ways that we can help very frustrated physicians and doctors and healthcare professionals out there to help these people that have chronic conditions. And to me, that's a big area. We talk a lot about, again, staying within scope of practice, but what are all these other areas where we can be that indispensable part of the team that can do something no one else can do on that team?
Yeah, that magic word again, and I want to stress this for people who really aren't aware of this. If you're relatively new in hypnosis and haven't done a lot of stuff with medical things or working with doctors or anything like that, I have students who, when they're beginning to learn hypnosis, they're concerned about working in the medical community. They think the medical community doesn't like us. They don't want us. They're out to get us. They're, et cetera, et cetera. My experience is that that's a hallucination that comes from not having found your way into that community. When I first came to Florida, the very first client that I had in Florida, I will never forget this, and it changed my life. The very first client that I had in Florida was a surgeon who was having anxiety attacks in the operating room. So I did work with him. It changed his life as well. But so I did work with him, and it was and it was successful, and he was very, very happy. And the next thing I know, he started referring his patients to me for all kinds of things, and these cooperate, and then referring me to to letting other doctors and things know about me as well. Once you've found that connection, it really is a blessing to your practice.
And you just said something, Michael, it's part of it, part of that confidence. Because but 32 years ago when I started, I that same year started in the medical. And for 30, when I hear people saying, doctors where I live, they won't refer to, hypnotherapy. I have never had a problem getting referrals from doctors. It's just a matter of getting that confidence, having a little bit of background with some of these trainings, like the ones that Bruce did, all these different things that can give you that, and realize that you're already capable. If you're a skilled hypnotist on some level that just can do the basic hypnosis, you're already able to help a lot of people with a lot of these conditions, disease, the stress reduction, that's always part of every condition. And that you can do so much more than you realize. So to us, after taking that one day, I hope that everybody walks out, and they usually do, knowing I can do this. Even if it walks in the door and I don't even know what the condition is, I never heard of it before. It doesn't matter, because we're not dealing with that surface label anyway. We're dealing with
this one day training, you will walk away with one thing really, really important. You'll be dehypnotized from the hypnosis the doctor community has already placed you in.
From those limiting thoughts, exactly.
How many people, patients and hypnotists alike, have been hypnotized to revere doctors? Well, if you go in revering the doctor, you're not going in as a peer. When you have in your back pocket all of this information that Patti and Eric are going to share with you, it automatically puts you on a different level. You automatically have a little bit more of a peer level with doctors, and that's a reframing of perspective, right?
Yeah. And in our training, we cover a lot of the research. There's been a lot of research, and it's accelerated the last 10, 20 years, amazingly. So they get a lot of reference materials to, take them even further with whatever area of this they're interested in.
That's material that doctors will like. Reference material.
Yeah.
Reference material. Exactly. Well, listen, we're running through our time here again pretty quickly. So let's make sure, if anybody's out there, if you have some questions that you want to ask Eric or Patti, please either wave your hands or raise your hand or open up your microphone and shout it out, because this will be the opportunity for you to do that.
Ray, go for it.
Where can we find out more about the 50-hour program, medical hypnosis program?
Yeah, uphypnosis.com is the website. Uphypnosis.com. Up, like look up in the air. It stands for Unlimited Possibilities. That's the name of my company, uphypnosis.com. Yeah, it's all on there. Just look under the medical hypnotherapy training. I was just going to say, somebody, Steve, I think it was, said that he works at a medical center. I was just looking in the chat. It was really interesting. And then I lost it.
I got it here. He says, I have over 3 years as a volunteer at a major medical center in Phoenix, and I had free run of the hospital, the ER to the top floor. I think he means in terms of being able to interact with people and their hypnosis.
You can tell that
he's pointing at himself.
Program that she started here at Sweehaw, and started a program at the hospital. I was there. We got free run of the hospital. I went from the ER all the way up to bariatrics, pre-surge, pre-op, post-op. I worked in the baby factory, everything with women who had problems birthing, cramps, etc. It was a great training ground.
Nice.
Fantastic. The only problem I ran across was with the doctors in the hospital were running so busy. They'd say, yeah, hi, hey, come over here, take care of this one. And, I'd go into the ER and say, can you help me with a patient in room number 3? She's screaming. She's driving this place nuts. And he goes in. I went in there with one doctor. I went in. I got the lady down, and she was quiet. The nurse walked in. She said, I have your morphine. And she said, I don't need that crap anymore. I'm doing fine. And the doctor walked in and he said, how's she doing? I said, she's doing fine. And he said, how do you feel? She said, I feel pretty good. How's your pain? And she just paused and says,
As soon as they put their attention on it, yeah.
it's right back there.
And I'm wondering, because you're in Arizona, right? Because that's where the medical hypnotherapy was, the National Board for Hypnotherapy, for Medical Hypnotherapy, and there was the hypnoanesthesia. All of that is where I got started in the early 1990s, and that place closed in I think right around 2000 or 2001. But there was a lot of medical, so I'm wondering if that influenced some of the hospitals in that area. I'm sure Paul Durbin was in that area, and a lot of people that I studied with in those early years came from that area. So we can all make a difference wherever our little world is, we're in our area. It's our job, I think, be
Julianne, do
ambassadors.
you have a question? Julianne? Did you have a question? Oh, I'm sorry.
She's shaking her head no.
I misled you, but Julianne question earlier, or she opened up her microphone earlier, which is why I thought you wanted to ask something. We're just a couple minutes away from the end here, so I guess if anybody else has a question, please do ask it now or put it in the chat. But in the meantime, maybe Patti or Eric, I don't know which one of you would like to do this, but if there's something in particular that you want to make sure gets said out here.
Yeah, I'd like for Eric to talk about what do you anything new you've been thinking about that you'd like to, because we change it all the time. We're adding things to this training. Anything additional that you'd like for us to help people take away from this training?
Well, I think to sum it up, it's to build confidence that the skills you have can be applied to help people with medical issues, will help your practice grow, and we'll give you techniques and scripts and an understanding of how to apply it.
Perfect. Well said.
Lovely.
Sounds like you walk away with a toolkit that can be used.
Absolutely.
That little doctor bag.
Great.
Great. All right. Well, we are looking forward to this. The HypnoExpo coming up in May with all these wonderful pre and post conferences. And by the way, you guys, Patti and Eric, I know I'm sorry I'm not prepared to point out exactly what they are, but what I know is that like all of the other presenters that present our pre and post conference programs, they also are showing up various places throughout the course of the weekend, doing a 1 hour talk or a seminar.
Yeah, I'm seeing here Eric's teaching transformational core continuums and Patti integrating with the medical community. So far, I'm sure there are more. I'm looking quickly.
I'm teaching a 2 hour on Sunday called Healing Circle Triad, which is something that came out of teaching these classes. It was a technique that kind of created itself on the spot one day that I developed further and turned into this wonderful process that you can do for healing.
Sounds phenomenal.
Nice. All right. Well, we are so looking forward to this. And Patti, I've been wanting to see you for quite a while, so it would be lovely to, of course, to see you at the expo, but I expect to see you before then. And we are at the end of our time. So what we'd like to do, and Bruce, I don't know if Bruce is still here with us. He might have already gone away, so he may be missing his third of the thunderous applause. But we'll have to let him know about them. So everybody, let Eric and Patti know how much you appreciate the time that they've spent with us, and we'll look forward to seeing you all at the expo. Open up your
Thank
microphone.
you.
See you in
so much.
Orlando.
Thank you for everything.
Thank you.
Thank all of you.
Thank you.
Thank you so much. Forward to seeing you.
Thank you very much.
Bye-bye.
Night, everybody. See you at the expo.